In my most recent video on gastrointestinal and urinary problems and disability, I noted that the need for frequent bathroom breaks can sometimes qualify a person for Social Security disability, and that sparked some interest. So today I'm going to be talking about bathroom breaks and other conditions that cause a person to be temporarily incapacitated, and how those problems can qualify for disability, and the best way to present your case if you have a condition that causes temporary incapacitation. Hello, I'm John Foster. I'm a medical doctor who does Social Security disability exams, and as usual, everything I say reflects my own opinions based on my own experience and study, and not the opinions of the Social Security Administration or any other medical body. Now, to begin, it's important to understand what Social Security means by disability. And they mean that a person cannot reliably meet the requirements of a simple entry-level job. Note, that doesn't mean the person can't do their normal previous job. It means any simple entry-level job, such as sitting at a desk, answering the phone, or putting mailers into an envelope. For them, a job means 8 hours a day, 5 days a week, with 3 breaks, one in the morning, usually 15 minutes, a lunch break at noon, and one afternoon break. If you can reliably meet the requirements of such a job, you will not be considered disabled. Again, that doesn't mean that you can't do your previous job. Some jobs are quite demanding. For example, I examined a dentist who was applying for Social Security disability. Dentists have to have a wide range of knowledge. They have to be able to stand for long periods of time, bend, do fine manipulation, and also have strength in their arms and hands. I once spent a morning pulling teeth with a dentist, and at the end of the day, my hands and wrists were sore. It's surprising how much resistance you meet when you're pulling teeth. Now, there are 2 sorts of conditions that can make one disabled. The first condition is a problem that is continuous. It prevents you from working at all times. And I recently examined 2 patients for Social Security, one of whom had a continuous condition that met a listing, and the other one had 2 intermittent conditions that probably would qualify them for disability. The continuous problem was a person who'd had severe complications of diabetes affecting both eyes, and they were completely blind in both eyes, could not even detect a very bright light. Now, that's continuous. It's present all the time. They'd seen eye doctors and nothing could be done. Temporary conditions are different. The patient may be perfectly able to perform the duties of a job some of the time, but at other times their temporary condition renders them unable to work. Types of temporary conditions include the need for frequent bathroom breaks, either due to the need to urinate, have a bowel movement, or to vomit. This is especially important if the need for frequent bathroom breaks comes on urgently and suddenly, and the patient cannot wait and has to abandon whatever they're doing and rush to the bathroom. Another type of temporary condition that can cause incapacitation is temporary loss of consciousness, and this is usually divided into syncope or fainting, which is usually due to either problems of the nervous system or the heart, and seizures or epilepsy, where the person has a convulsion, usually is unconscious, and this is due to a problem with the brain. Both frequent bathroom breaks, seizures, and syncope tend to be relatively short duration, from minutes to hours. There are other conditions that can cause temporary incapacitation that can last longer, days to weeks, and these include gout, a severely painful form of arthritis that comes on suddenly, usually in 12 hours or less, usually in the foot, and is so painful that the person can't stand or walk on the affected foot. And with treatment, it usually lasts about a week. Another one is complications of diabetes, either hypoglycemia, blood sugar so low that it causes the person to become confused or even unconscious, or hyperglycemia, where the blood sugar becomes so high that the person is seriously ill and usually needs treatment in the emergency department and often needs admission to the hospital, and that can last for up to 1 to 2 weeks. Other conditions that are chronic can also have flare-ups. Examples are a person with asthma who has severe asthma attacks from time to time, requiring them to go to the emergency department or even be admitted to the hospital. Other breathing problems that can flare up, like COPD, and other problems like heart failure that can have severe flare-ups where the person may even need admission to the intensive care unit, but at other times is doing fairly well. In the case of my second patient who had temporarily incapacitating conditions, they had a double whammy. They had epilepsy. Their seizures had begun in early teenage years. They were taking seizure medicine, which helped some, but they were still having 1 to 2 seizures per week where they went completely unconscious. And then they also had inflammatory bowel disease where they had frequent diarrhea. They said about 7 to 8 episodes during an 8-hour workday. And when they had diarrhea, they had to rush to the bathroom immediately. Again, they were receiving treatment for the inflammatory bowel disease, which helped some, but didn't make it all better. Now, this raises an important point, which is most people who have temporary conditions, when I ask them to pin down how often do they have the conditions, they have no idea. And imagine this. Imagine you're shopping for a new car. You go to the car dealership, you find a car you like, and you ask the salesman, how much is that car? And they say, well, it's not very much. And you ask them a few more questions, and finally you say, I want to know exactly how much that car costs. And they say, well, I'm afraid I can't tell you. You wouldn't be very pleased, would you? And you probably wouldn't buy the car. Well, in the case of a Social Security Administration person evaluating a disability case, if they approve the case, they're likely going to pay out over time the cost of a new car. And with any sort of condition, they want to know exactly how bad it is. And if you have a condition that temporarily incapacitates you, you need to know how often does it happen, when it occurs, for how long are you incapacitated, and also when was your last episode, when was your last seizure, for example. Also, if you're prescribed a medication to control this condition, Social Security wants to know if you're taking that medication regularly. Social Security will not require people to have surgery to improve their condition, but if it is a condition that would improve with medication, like for example most cases of epilepsy, and the person chooses not to take the medication, Social Security is liable to deny the disability application. So here's my recommendation that will really improve your chances of getting your disability application approved. Get yourself a notebook. It doesn't have to be expensive or fancy, and carry it around. And every time you have an episode, whether that be fainting or having to go to the bathroom, write down the time, the date, and how long the episode lasted. If you're doing this for a condition that occurs multiple times a day, like inflammatory bowel disease and diarrhea, I'd record for about a week. If you're doing it for a less frequent condition, such as exacerbations of asthma or seizures, I would do it for several weeks to several months. Keep that notebook. It can be very valuable. If you are scheduled for a Social Security disability exam, bring the notebook so you can show the doctor how often your condition occurs. And if you're appealing and are going to administrative law court, bring the notebook, because I can guarantee that the judge will be impressed by the fact that you have written evidence of how frequently you're disabled. Don't be the person who, when asked how frequent are their episodes, how long do they last, and when was the last one, gives the blank look that indicates that they have no idea. Well, I hope this has been helpful, and as always, remember, if it happens, it's possible.